Okay. Okay. Good evening, Vinod. So no live disturbance today. Last time there was so much of disturbance in the live session. So hi, good evening, Blessy. Good evening, Vinod. Good evening, Vinod. So no live disturbance today. Last time there was so much of disturbance in the live session. Okay. So today in this session, I am going to revise about the important topics in child health nursing, so growth and development. And coming to my classes, so I am receiving so much of love from all my subscribers who have made the subscription public here. And thank you for all the subscribers who had faith in me and have subscribed my channel and watching my videos and giving a good number of views to my videos. Thank you so much. With your encouragement, I'll be doing much more subjects and much more topics for you, which will be very helpful for you people in the future coming classes. Joshna, good evening. And thank you all the subscribers. Thank you so much. Thank you from bottom of my heart for having faith in me. And today I'm going to take about this growth and development, pediatrics. Hope all are ready with the classes. So no voice disturbance. So whoever is on online, please comment whether the audio and video is clear. Please let me know. Sharu, good evening. So there is any lag between my voice and the video is coming online. If there is any such, please let me know. So today we are going to see about pediatrics. So pediatrics is, so as you know, so the pediatrics. Okay. So here the word pediatrics has been, so the meaning of pedia is child and the meaning of atrix is healer. So pediatrics is, pedia means child and atrix means healer. So we hit the main topic of discussion today will be about pediatrics, growth and development. So we will be learning the terminologies. Sharu, no ma'am. What happened, Sharu? Whether video is not clear or audio is not clear. What's wrong? Let me know. Sharu, anything? Is there anything you want me to know? Any voice disturbance or anything terminologies I have named it wrongly here? Okay. Then important definitions here. So if you look at the definition, so here neonate, if you look at the neonatal period, it is around divided into two categories. One is early neonate and the other is late neonate. If you look at the newborn, once the newborn is there, so it is around 0 to 28 days, we called it as the neonate, and it has been again divided into early neonate and late neonate. So the baby which is just born, we consider that as the early neonate, which lasts for around 0 to 7 days, and after 7 days we are going to tell the baby as the late neonate, that is around 7 to 28 days. Clear? Then coming to the, so after 28 days, what we will call, what we will be calling the child till 1 year of age. So what we will be calling the child? So after that the infant period starts. So if you look at the infant period, which is around from 29 days to 1 year. So this is the infant period, which lasts around 29 days, means almost from 1 month to till 1 year, we call it as the infant period. Then toddler. So toddler is around 1 to 3 years of age group, we call it as the toddler group. So 1 to 3 years of children. Then coming to the preschooler. Preschooler are who? So the children who are around 3 to 6 years of age. So before going to school the period is there, no? That we call it as a preschooler, which is around 3 to 6 years of age. Then coming to school going children. So school, the age group which have been divided, so 6 to 12 years. 6 to 12 years is called as the school age group. So understood? So from 1 month to 1 year we call it as infant, and 1 to 3 years we call it as the toddler period, and preschooler, which is around 3 to 6 years group, we call it as the preschool, and school age group is divided into 6 to 12 years age group. So all these terminologies is very essential when coming to in exams. When the questions is asked regarding the toddler period, what and all the milestones is going to the child is going to finish, or in the infancy period what the milestones the child has to achieve. So you must know what is the infancy period and what is the neonate period, and how the neonate period is divided into two, that is early neonate and late neonate, and the same way the infant, toddler, preschooler and schooler. So, and after the schooler the adolescent period starts. If you feel the video is much lagging, once the live session gets over, you can play the session in 1.25x speed and you can watch the session, means if it is slow in nature. Then coming to the adolescent period is again divided into early adolescent, middle adolescent and late adolescent. If you look at the early adolescent, that is 10 to 13 years age group, we call it as early adolescent. And coming to the middle, so middle age group is around 14 to 16 years age group, we call it as the middle adolescent. Then late, so late adolescent is around 17 to 19 years. So if you look at the adolescent period, it is almost 10 to 20 years of age group. So between this 10 to 20 years of age group, we call it as the adolescent period, which is divided into early, middle and late. Clear? Any doubts in this? Okay. Thank you, Vinod. Thank you for the confirmation. Then coming to the head circumference of the newborn. So coming to the head circumference of the newborn, at birth the baby's head circumference is around, that is HC, head circumference is around. So this is the way we are going to check the head circumference, which is around 33 to 35 centimeter. And when you look at the normal baby, newborn baby, Indian newborn baby, it weighs around 2.5 to 4 kgs. So in the examinations usually they will ask the range. So they may ask the baby if that is 2.8 or 2.9 or 3.5. If whichever is the closest range, try to mark that answer as the correct answer. So 2.5 to 4 kgs is the normal weight of a newborn. Coming to the average Indian baby weight, it is around 3 kgs. Understood? And if you look at the weight of the baby when it doubles, so weight doubles by 5 months. So at birth if it is 3 kg, at 5 months it is going to be around 6 kg. So weight is going to doubles around 5 months and it triples by 1 year of age. Understood? So around 1 year there will be around 9 kgs of weight. Understood? So this is about the normal parameters. So whenever any weight like that is asked, you have to say the range, that is 2.5 to 4 kgs. Like that range you have to say. When coming to the head circumference, 33 to 35, that is a range. When you minus 3, so in 33, so if you minus 3 centimeter, we are going to get the chest circumference. So chest circumference is around 31 centimeters. So for in a newborns, chest circumference will be much smaller compared to the head circumference. Okay. So when you look at birth, what will the baby's length? So the baby will be around 48 to 50 centimeters. So 48 to 58 centimeters is the baby's length at birth. And you look at the when the baby's height is going to double. So when the baby reaches around 4 years of age group. So when the baby is around 4 years of age group, so from 50 centimeters, the baby will be around 100 centimeters of length in height. And the baby length, the baby height triples. That is when the baby is around 12 years of age group. So when the baby is 12 years of age group, it is going to triple. So at birth 50 and around 4 years of age group, it is 100, and at 12 years age, it is 150. So you may get MCQs in the exam. So when will the baby's height will double? double at which age? So they may give options like 2, 3, 4, 6. So you are going to mark it as 4. And if at all a question is asked, so when the baby's length is going to triple, that is around 12 years of age. Any doubts in this session? Okay. Then tips from my side for the students who are going to write the exams. So practice time management. As I have already been giving tips to all the students who are watching my session. So during the exam, try to manage the time wisely. And if you are getting tensed, please perform some or the other breathing techniques. Inhale nicely, exhale, do pulsatile breathing, and don't take tension to your mind. And in the tension, don't wrong the wrong answers in the exam. So breathe easily and relax yourself. Do some relaxing techniques. And once you finish the one section, then go to the other section, and don't be tensed in the exams. And have nice water and take care of your health during the exams, and do well in the exams. All the best from my side for all the students who are going to appear for this NORCET as well as ESIC, and whoever got selected in the military nursing service, the female candidates. All the best from my side who are going to attend the interview. Especially from our side, Telangana, around 2 people have been selected for this military nursing service. So all the best for your interview. Congratulations from my side and from my channel Healthcare Hub also. And those who are come far in this my video, please like our channel if you feel the content is worth of it. Then coming to the vitals of normal neonate at term. So what is at term? So term is around 37 to 42 weeks. We call it as a term baby. So what will be the heart rate? Heart rate of the baby. So what will the heart rate of the baby at birth? It is around 120 to 160 beats per minute. If in exam they may give. Okay. So if in exam it is given like 120 to 140, 120 to 160. So you please mark this 120 to 160 is the exact answer for normal vitals of the newborn. Coming to the respiratory rate. So the respiratory rate in a term baby is around 40 to 60 per minute. 40 to 60 cycles per minute is the normal respiratory rate in a newborn. Then after birth, within how many hours the baby should urinate? So within how many hours the baby should urinate? That is within 24 hours the baby should urinate. Otherwise we tell the mother to breastfeed the child, so that until the baby is not going to pass urine, we are not going to discharge the mother or the baby from the hospital or with whatever the institution they are. So within 24 hours we are going to watch for the urine elimination from the baby. So in exam they may confuse like 24 hours, 48 hours, 12 hours like that. So 24 hours is the period. Clear? Okay. Then stool. So as the newborn, what is the stool, whatever the baby passes immediately after the birth? Let me know in the comment section. Sharu, I got 50% but not selected to military nursing interview. Oh dear. Glad to know that you have at least tried from your side and you wrote the exam. When I applied for this military nursing, in the first attempt I got selected. A written exam I wrote in Pune, and the interview was in Delhi. Physical fitness was in Delhi, and the interview session was very tough and good. But because of one condition, I was not selected in my military nursing interview. I will let you know in my other classes. Okay. Now let me know what is the stool the baby immediately passes after the birth. Please comment in the comment section so that I will come to know how much you people are listening to my class right now. Anybody online? Is there any disturbance in my voice or audio or video? Okay. Let me tell you. So immediately as soon as the baby is born, so the stool the baby is passes. Yeah, Sharu, you are correct. Vinod, you are correct. Very good, Vinod. So that is called as meconium. So within how many hours the baby should pass the meconium? It is within 48 hours the baby has to pass the meconium. Then Blessy, 48 hours. Very good, good. Sharu, Blessy, Vinod, very good. Those people are answering in the comment section. Good. Glad you are answering whether it is right or wrong. If people are coming forward and answering the questions, very good to know. Then what is the normal weight of the newborn baby? That is range I have already told you, that is 2.5 to 4 kg is the normal range. Then coming to the LBW. So what is this LBW here? So LBW, it is not related to like cricket. It is related to here the babies. So that is called as low birth weight. So what is the low birth weight? So if the baby is less than 2.5 kg, we will call it as low birth weight babies. And again, this low birth weight babies have been divided into very low birth weight, extremely low birth weight, and so like this it has been divided into 3 categories. That is, depending upon the weight, we have divided the baby's weight into LBW, VLBW and ELBW. That is, so LBW, VLBW and ELBW, that is low birth weight, very extremely low, very low birth weight and extremely low birth weight. So when we consider it as a very low birth weight, that is if it is less than 1.5 kg, we call it as the very low birth weight baby. And if the baby is less than, even more less than 1.1 kg, then that is we call it as extremely low birth weight baby. Yeah, Vinod, Divya Mohan, good evening. Thank you for answering. Then capillary, then we will see capillary refill time. So what is this capillary refill time and how we will check in the newborns? So capillary refill time, capillary filling time, or so we also call it as CFT, as we call it as CFT, we call it as CRT, that is capillary refilling time. So how we are going to check? So imagine in a newborn, how we will check this capillary refill time is, you take your finger and keep it on the baby's chest. So once you keep it on the baby's chest, you are going to count it as 001, 002, 003. And once you take out the finger by the count of 004 and 005, within 3 seconds, the baby's color, the baby's skin color on the sternum should come to return to a normal color. That is called as capillary refilling time. To check the circulatory status, if there are chances of the child, the baby, the newborn baby going into shock, to know that we need to check this capillary refilling time, CFT or CRT, which should be less than 3 seconds. Let's see, yeah, correct, exactly. You can ask more questions, ma'am, that really help us to motivate and you too, ma'am. Oh, thank you. Why not, Vinod? Then normal, okay, what is the normal length of the umbilical cord? So what is the normal length of the umbilical cord? So the normal length of the umbilical cord is around 50 centimeters. As I already told you, you can relate the same question with other also. Like what is the normal length of a newborn baby? Normal length of a newborn baby is also around 50 centimeters, and normal length of the umbilical cord is also 50 centimeters. Then normal BP. So what is the normal BP of adults? So what is the normal BP of adults? So normal BP of adult is around 120 by 80 mm of Hg. The same way. So once you make it half, that is the value of the, so that is the value of the children. That is around 65 to, that is around 65 to 45 mm of Hg. Clear? So the adult value whatever there, into that half means 120 half is 60 and 80 half is 40. So just like that, 65 to 45 mm of Hg is the normal blood pressure of a newborn. Clear? Then vitals of the normal neonate at term. So when you look at the blood volume at term, so once the baby at term gestation, what will be the blood volume? That is around 60 to 80 ml per kg is the milliliters per kg is the normal blood volume per kg in a term baby, newborn baby. And whereas compared to the preterm baby, the blood volume is much more, because preterm baby has more requirements of oxygenated blood, nutrition and nourishment. For that purpose, the preterm has a more blood volume compared to the term baby. Clear? Then every newborn baby, once it is born, we will give vitamin K injection. So why this vitamin K injection is given? So as the newborn baby is born, the baby's gut is sterile. So the mothers may ask questions, why you are giving this vitamin K injection? So we have to answer that if you are not giving vitamin K injection, the baby will have these chances of bleeding. In exam, sometimes they will be asking the questions, so they will be asking questions related to like why you are giving, the mother is asking doubt regarding vitamin K injection. So they will answer like, because the gut flora is not there for the children, for the newborn babies, or vitamin K prevents bleeding. So you are going to answer it as, because we are educating the mother, vitamin K will prevent the bleeding tendencies in children. That should be the answer. Clear? Both are the options, but according to the question we must opt the correct answer there. Clear? So the vitamin K, because the baby's clotting factors, the liver clotting factors are not developed, and the clotting factors are like 2, 7, 9, 10. So these are the clotting factors. The liver is underdeveloped and these clotting factors are not produced. That's why as soon as the baby is born, we are going to give injection, vitamin K injection. And looking at the dose, so the dose is around 0.5 mg. So if the baby is less than 1 kg, we are going to give 0.5 mg phytomenadin or vitamin K injection. And in 1 kg babies, we are going to give around 1 mg of vitamin K injection. I have also made one short video regarding this vitamin K injection. If there any possibility, please go and watch, you will come to know. Then site. So usually where we will give this vitamin K injection, it is given at the anterolateral aspect of the thigh. For example, this is the baby. So if this is the thigh. So in the thigh, anterolateral, on the anterior side, lateral side, if you divide the thigh into 3 regions, so in the middle portion we are going to give the injection to the baby. So that muscle, so there may be questions may be asked, what is the site? So that is anterolateral side. And which muscle we are going to give the injection? That is vastus lateralis. Clear all of you? Any doubts? Ma'am, our chats reaches to you late. Yeah, there is a little bit this internet connectivity issue. Compared to my last session, this is much better. At least I am able to interact with you. Last time the session was completely stuck, my psychiatry session. Okay, vitals of normal neonate at term. So what is the vitals of normal neonate at term? So every newborn baby, as soon as it is born, we are going to give vitamin D drops. So for the vitamin D drops, the dosage is around 800 international units. And in preterm, that is less than 1 kg baby, preterm baby, less than 37 weeks, we are going to give around, that is 800 international units of vitamin D drops. Then in term babies, how much we are going to give? So in term babies, it is around 400 international units. As I have already said, compared to the term, the preterm will have more need of oxygenated blood and all the nutrients necessary. So that's why the term dosage is compared to less compared to the preterm. Preterm is much more high. Then the duration. So what will be the duration of this this vitamin D drops? It will be given till 1 year. So whatever the one-line questions I have been asking, it is very, very important for your CHO exam, state exam, central exam, whichever kind of exam you people are writing. It is very, very necessary. And please, I will send all these notes in my Telegram group. I have already mentioned that Telegram group link in my description box. Please go through that. It will be very easy for you to go through the notes later. Okay. Then coming to the classification based on the gestation age. So here what does the gestation means? Gestation is nothing but it is pregnancy period. So depending upon the gestation, the baby, the fetus. So depending upon the gestation age, at what time the baby has delivered. So that is preterm. So if it is less than 37 weeks, we call it as a preterm baby, less than 37 weeks. And term baby when? So 37 to 41 completed weeks, we call it as the term baby. Term baby is 37 to 41 weeks. Then coming to the postterm. So postterm babies are those who are less than 42, not less than, sorry, more than 42 weeks. Term babies. So those who are more than 42 weeks, we tell that as postterm babies. So those are postterm babies. So depending upon this, now I am going to show the chart for you for. So usually in the exams time, they will be asking regarding this 10th percentile, 90th percentile. So what does that terms literally mean here? That 10th percentile, and so here I have marked the baby weight. So this is nothing but intrauterine growth chart. So this is also called as intrauterine growth chart. So depending upon the weight, here I have marked 500, 100, 500,000, 2000. This is the weight of the baby, that is birth weight. And here I am going to mark about the weeks. So here weeks, just now I have told about term, preterm. So this is a postterm, term, preterm babies. So here I am going to mark about the weeks, 26, 30, 32, 36, like that weeks I am going to mark. So this line stands for here the gestation weeks here, and this line here we stands for birth weight. And you look where once here a line is drawn, this is 10th percentile. 10th percentile, and this is 90th percentile. So depending upon this chart, we will come to know the babies exactly what is the intrauterine growth chart. So when you look at this intrauterine growth chart here, so if the baby is born around for example 3.2 kgs, and the baby is born at the week of 40 weeks. So where I am going to mark it? So around 3.2 kgs. So it should come around here. So it will be coming around here, right? And if it is 40 weeks, and exactly I am going to mark the baby here. Understood? So with where it comes near this AGA. So this is 90th percentile. This is 10th percentile. So AGA stands for what? AGA means appropriate for gestation age. AGA. Whereas SGA means small for gestation age. And LGA means which is large for gestation age. So depending upon that, we are going to categorize the child into, the newborn baby into, that is small for gestation age, appropriate for gestation age, and large for gestation age. So depending upon that, so this is term. So 38 to 42 weeks is term gestation. Then 42 to 46 is postterm gestation, and preterm is 24 to 38 weeks. So whichever baby comes under this category here below, if it comes here, if the depending upon the weight, if you mark, then it comes under 10th percentile. If the baby weight is come above this 90th percentile, anywhere here, if you are going to mark according to the birth week or birth weight, then it will come above 90th percentile. So many questions have been asked related to this 90th percentile, 10th percentile. Hope my explanation is clear for you people. So understood the terms LGA, AGA and SGA. So understood this chart? Let me know in the comment section, all of you. Understood this chart? So this is not as much as difficult it seems to be. It is very easy to understand. Here I have explained you with the example SGA, AGA, LGA. This is whatever that comes under here, that is 10th percentile, above that 90th percentile, and this below is in between is appropriate for gestation age. Clear all of you? Okay. Thank you, Sharu. Then in the previous terminologies, I have told you about this other terminologies. Now I must cover the rest of the terminologies also. If the extremely preterm baby, so those who are born less than 28 weeks, we call it as 28 weeks, we call it as extremely preterm babies. And more preterm is 28 to 31 weeks plus 6 days is called as very preterm. And moderate preterm is 32 to 33 weeks plus 6 days. And late preterm, again it has been divided here, 34 to 36 weeks plus 6 days. So these are the categories of the preterm, very preterm, moderate preterm and late preterm. Clear? The slides are clear? Any blur like that thing on the screen? No? Okay. Which of these parameters should be assessed during the first minute of life in a newborn? So as soon as the baby is born, what are we are going to check? Whether it is gestational age, sex, muscle tone. Option B, weight, length, head circumference, color, respiration, temperature, color, respiration, heart rate. So here, as soon as what the question is about, what are the parameters should be assessed? First minute. So first minute they have already mentioned in the question. So what we are going to see about here, what are we going to see? That is about Apgar score we are going to see now. So let's see about this Apgar score. So if you look at the Apgar score has been, it is here I have named, that is 0, 1, 2. So 2 is the score where we are going to give for the best one we are going to give. So this Apgar score was first started by Miss Dr. Virginia Apgar. Virginia Apgar in 1953, she started this scoring system for the clinical assessment of the baby. Usually at what time we are going to assess? In the first minute, 5th minute and in the 10th minute we are going to see the Apgar score. And coming to the Apgar score, so the terms already they have told here na, Apgar. So A, P, G, A, R. That is with her name itself we are going to see. So here A stands for appearance. So at birth how the baby appears. If the after the birth of the baby, if the baby is completely blue in color, means all the hands, legs, body, head, everything is bluish in color, we are going to give the score of 0. Understood? If the extremities, if the hands, both the legs are cyanosed, acrocyanosis, and the face and the body is pink in nature, we are going to give the baby a score of 1. Clear? Then if the baby is completely pink, we are going to give the baby the score of 2. Understood? Then coming to the pulse. Pulse is nothing but the heart rate. So if the baby has no pulse, you are going to give the score of 0. If the baby's pulse rate is more than 100, we are going to give a score of 1. If the baby's score is more than 100 beats per minute, we are going to give a score of 2. Then coming to the grimace. So grimace is nothing but grimace, or sometimes they may also ask as grimace or reflex or irritability. Reflex irritability. So reflex irritability. So when we try to, in the newborn baby, when we try to take this OG tube, orogastric tube or nasogastric tube, when you try to enter it through the baby's nose, immediately how the baby will do? The baby will immediately go back, or the baby will try to make facial expressions and try to remove it. So if the baby is giving no response, you are going to give a score of 0. If the baby is giving a grimace on slight stimulation, the baby is on slight stimulation, if the baby is moving somewhat, then we are going to give a score of 1. Then if the baby is crying vigorously, so the baby is crying vigorously, we are going to give 2 in the reflex or irritability. Just now I have told, no, take OG tube, orogastric tube or nasogastric tube, trying to introduce through the mouth or through the nose. Immediately if the baby is not giving any response, we are going to give it 0. If the baby is going to respond a little bit, we are going to give a score of 1. If the baby is crying vigorously, then we are going to give the score of 2. Then next one is activity. So here what is activity here? So activity is muscle tone. So the muscle tone of the baby, how the baby looks. So if the baby's muzzle tone is relaxed without any, means there is no movement in the baby. The muzzle tone is how usually newborn baby looks. It will be like completely like a flexed one. Both hands and legs, it will be flexed like this. If there is no movement, we are going to give 0 for the baby. Or if the baby's legs or hands, if you look at the baby's legs, a little bit movement, not a vigorous movement, little bit of movement is there, we are going to give a score of 1 to the baby. If the baby is crying vigorously, how you cries the baby? Like that. If the baby is crying vigorously and moving all the hands and legs continuously, we are going to give a score of 2. That is activity. Then coming to the respiration. So respiration here is, see, in respiration, what happens? Respiratory rate does not comes under. It does not comes under this Apgar score. Here we are going to see the respiration and respiratory effort. Means how the baby is crying. Respiratory effort we are giving. So sometimes in exams they may ask questions, one MCQ related, like whether respiratory rate is there in Apgar score or not. It's not there, and it is also not there in neonatal resuscitation protocol. In neonatal resuscitation protocol, Apgar scoring is not taken into consideration. Clear all of you? Any doubts? Understood. So if there is no respiration, around 40 to 60 breaths we have already told now. If there is no respiration, we are going to give 0. If there is weak, irregular, slow breathing, we are going to give 1. If there is a strong cry, we are going to give a 2. So if you look at this crying baby, so how this crying baby looks, see, if the baby is crying vigorously, we are going to give a score of 2. Clear? All of you, let me know in the comment section. Is it clear? Explanation is clear? Understandable? So when we are going to give a score of all Apgar, we are going to give a 2, 2, 2. So around 10 will be the score. So 10 out of 10 is the good baby, means healthy baby. If the Apgar score is less than 7, if the Apgar score is less than 7, so 7 to 10 is considered as excellent. So 7 to 10 is considered as excellent. Okay, clear? Sharu, clear? Okay. So 7 to 10 is considered as excellent in the Apgar scoring, and 4 to 6 is considered as fail. And if the score is 0 to 3, it is considered as poor. So as I already told, Apgar scoring should not be considered as one of the parameters in resuscitation. So understood all the parameters Apgar: appearance, pulse, grimace, and so what will be our answer in this question? Anybody answer? So in these 4 options, which will be our option? So it is this one, color, respiration, and respiratory rate not is there, but respiration is there. Understood? Okay. Then, so what is the legal age definition when it coming in the children age group? So if it is less than 18 years, we consider it as child. That is the definition of child. And minimum age of marriage in India. So this about, I am talking about India. So if it is less than 21 years, we call it as minimum age for marriage in India. For boys, it is less than 21 years, and for girls, it is less than 18 years. And responsibility of a crime. Have you heard of this juvenile delinquency? So juvenile delinquency, okay, we know the option D. Okay, good. So juvenile delinquency is when the child is committing any crime. So that comes under, so if they are under the age group of 12 to 18. You might have known about this Nirbhaya case. where one of the person has escaped this crime under this juvenile, because he was less than 18 years at the time of committing crime. But those who were above 18 years, they all were given death sentence and they were hanged later. So that one boy was below 18 years age group. So juvenile crime, if the person is under this age group 12 to 18, we consider it as juvenile criminal. Then compulsory free education is for 6 to 14 years age group in India. Yeah, points clear to you? Okay, which of the following is not a component of Apgar score? Heart rate, respiratory effort, temperature, or reflex irritability. So what is the correct answer? So who were 7 members who are online? Just to answer this question. ఒక్కల జోష్న ఎక్కడున్నావమ్మా? ఆన్సర్ చేయట్లేదు. மற்றவங்க ப்ளீஸ் ஆன்சர் பண்ணுங்க. என்ன பண்ணிட்டு இருக்கீங்க? லைன்ல மட்டும் இருக்கீங்களா? काइंडली आंसर जो भी लाइन में है आप आंसर करिए, ताकि हम जान सके आप क्लास सुन रहे हैं कि नहीं करके. मैरिज मोर देन, sorry, oh I told less than na, right, it is more than 18 to 20 years. Sorry, little bit of correction needed there. It is more than 18 to 21 years. Yeah, so the correct answer is temperature. So temperature monitoring will not come under this one. So in Apgar score we are not going to check the temperature. C. Okay, Sharu C, Vinod C. Okay. Okay, next question. A nurse is assessing the oral cavity of a 6-month-old infant, 6-month-old baby. When we are seeing, the parent asks which teeth will erupt first. So how should the nurse respond? So in a newborn baby, which teeth usually erupts first? Whether it's incisors, canines, upper molars, or lower molars. So when you look at the diagram of this, okay. So when you look at the incisors, so these are called the upper central incisors, and these are called the lower central incisors. So these lower central incisors are the first. So they are the first to erupt. So in a children around there will be 20 temporary or deciduous tooth in children. In adults it is around 32. So understood? And we have to write this in the name of formula. So whatever the first is there, these are called as incisors, and next to this is lateral canines. So canines is the teeth which is essential for tearing the food. Then these are premolars, and the last one is called as the molars. So this is called as the molars. Clear? So this is the central, these are the upper incisors and these are the lower incisors. So next to these are the central incisors and these are the lateral incisors. So next to the incisors we will find this canine. So incisors, canine, premolars, molars. So this is the formula how we have to write, and how the formula have to be written, that is 2 incisors, 1 canine, 2 premolars and 3 molars. Understood? So this is the dentition. So this process of development of tooth in children, this is called as dentition. Understood? So this is called as dentition. So primary tooth, deciduous tooth. So that is the milk tooth, whatever we say, that is called as temporary deciduous tooth. Then once the temporary tooth falls off, again we get this permanent tooth. So the one whichever is in front of you. So as I am teaching in the class, just you try to palpate the front one. This is central incisors, the front one. Clear? So the first and last primary teeth is lower central incisor, and the last primary teeth is molar, second molar, and the first and last permanent teeth, that is molar 2 and molar 3. And if there is a delayed dentition, when we call it delayed dentition? When the baby is getting teeth after 13 months. 13 months is almost after 1 year of the birth of the baby. If the baby is getting teeth, we call it as the delayed dentition. Clear? That is 13 months. Clear? Understood regarding this temporary tooth, permanent tooth, the dental formula. So how we have to write this dental formula? That is, upper one is 2123 and the lower one is 2123. Incisors, canines, premolars, molars. So this is the dental formula. Clear? So according to the question, the nurse is assessing, so 6-month-old infant, so how we have to answer? So we have to answer the lower central incisors are the first to erupt in a child who is 6 months old infant. The lower, the bottom teeth. So as I already told, for your exam, stay calm, stay relaxed, don't take tension. If you are preparing for whole day, divide your session for your preparation of exams into particular hours, then you prepare for exam. Don't have a vigorous session, you are continuously reading for 24 hours. Take a break, go for cooking, go for walking, go outside, go for shopping. Stay, relax your mind, then only sit with the reading work and all. At test stretch, if you are sitting with the reading work continuously for hours and together, you will end up becoming a schizophrenia patient. You will be talking in your own self, hallucination, illusion. So you will be going through a rough phase. So stay calm during the exam, before exam, after exam. And how you people have celebrated your Holi, celebrated or not? This is the age, youngsters, go and celebrate with your friends. Once you finish your exams, we will have party. Clear? Okay, now we will see about fetal skull. So fetal skull, so this is the fetal skull. So this is the face part and this is the vault. So this complete thing is called as vault and this is the base portion. So this is the base portion. So these are the parts of the skull. So this is the base. Then, so coming, we will see about the types of sutures, whatever is there in the fetal skull. So this is the anterior and this is the posterior. So in many of the images, if you look in textbook also images, they will write it as here, like how we write direction, like that they will write S, I, L, M, like that they will write. That is superior, inferior, lateral and medial, like that. They will label the diagram in such a way for your understanding. Clear? So here this is the anterior side of the fetal skull. Understood? So if you look at the skull, this is also called as frontal suture or metopic suture. This one here. This is called the frontal suture. And this is coronal suture here. Is it there? So this is called as coronal suture. So the junction of this metopic suture or sagittal suture and the coronal suture, we have this anterior fontanelle. So here we find this diamond shaped anterior fontanelle which heals around 1.5 year in a child. So it takes around 1.5 year to heal or 18 months to close. Then when the body is divided into two, that is the sagittal suture. So this is the sagittal suture. And this back one, that is, it is in the shape of lambda. In the lambda. So here we call it as this as a lambdoidal suture. So when you keep your hand at the back of the skull, if you try to touch, that is called as the occipital protuberance. So the bone, so the suture which divides the lambdoidal suture divides the occipital bone and the parietal bone. And the two parietal bones here separated by the sagittal suture. And this coronal suture separates the frontal, this bone and the parietal bone. So understood about these sutures? And the back one, this posterior fontanelle heals around after 1.5 month or 6 weeks. So this is diamond shaped, heals around 18 months or 1.5 year, and this is back one around 1.5 month or 6 weeks, this is going to heal. Clear with the sutures? Coronal, sagittal, lambdoidal and the frontal or metopic suture. Then if you look at the biparietal diameter, so these diameters are very essential when we are studying this obstetrical or gynecology. In that subject it will be useful for you. So if you try to keep your hand on the head on the lateral side, if the front side if you keep, that is we call it as the bitemporal diameter, it is around 8.2 centimeter. And these are the eminences. So these are the actually ossification centers. Ossification, bone ossification starts here. Means the formation of skull. So they are helping in the molding process. So there are certain gaps, around 6 fontanelles are there. So the biparietal diameter is around 9.5 centimeter from one parietal eminence to the other parietal, whereas temporal here to here it is around 8.2 centimeters. Clear? Sharu, ma'am, your explanation is very beautiful. Take daily theory classes. I am busy with my my duties one side. After my duties I have to come home, I have to take care of my children, do cooking, do household chores, then how to take classes. I am trying my level best to take classes for you people, trying to do justice for my profession also at hospital and at work here. As you know, I am a senior nursing officer there, so I am trying to balance both. So why not? Trying my level best with the cooperation of my husband, I am taking classes. Okay, then coming to the skull here. So the portion between two eyes. So if you look at the two eyes, this particular portion, if you look at so this particular portion is called as the glabella. Clear? And this area we call it as the sinciput. And from this anterior fontanelle to posterior fontanelle, so this is called as the vertex. And from the posterior fontanelle to the bottom, this is called as occiput. So this is sinciput, vertex and occiput. So below the occipital bone we have this is called as the occipital protuberance. This is the protuberance. And below that region we have suboccipital region. And the chin. So we look at the chin, this is called as the mentum. So we have diameters with this, which you will learn in your gynecology or obstetrics subjects when it is taken. So these are the parts of the skull. That is, in between the eyebrows it is called glabella. And the anterior fontanelle is also called as bregma. This is called as bregma. And this is vertex, posterior fontanelle and occiput. So this is the temporal bone. And here we have this parietal eminence, which is parietal bone. Here we have this lambdoidal suture. And here we have coronal suture. So around 6 fontanelles are there, and these are the sutures. Hope this explanation is clear. Striking Shravan, తీసుకుంటానులే classes daily నీకోసం. Okay. Okay, the anterior fontanelle becomes ossified by 18 months, but it becomes pathological if it fails to ossify. So the anterior fontanelle, just now we have seen the. So the anterior fontanelle is also called as bregma. So this is also called as bregma. So what is the question here? It has to ossify by 18 months. That is, one end of here it has to ossify. But it becomes pathological. Pathological and physiological are two types of that. Pathological means which causes disease conditions. So when it will become pathological, so what will be the answer? Whether it is 18 months or before 18 months or after 18 months or before 24 months, means below 2 years of age or after 24 months. So the answer is, it is after 24 months. So what will be the answer? It is after 24 months. If the anterior fontanelle becomes ossified by 18 months, it becomes pathological if it fails to ossify. After 24 months also, if that anterior fontanelle it is not closing, then it is pathological in nature. Clear? Okay. So just now I have taken this skull class now. Now tell me, the meeting point between coronal and sagittal suture is known as what? Lambda, parietal eminence, bregma, or occipital eminence. So what is the meeting point between the coronal and the sagittal suture? So what is the meeting point between the coronal and the sagittal suture? So where did the coronal and sagittal suture form? So what is the meeting point is called? So here we have seen the so the question is, what is the meeting point between coronal and sagittal suture? So the question is, what is the meeting point between coronal? What is the meeting point between coronal and sagittal suture? So the other name of anterior fontanelle is what? That is bregma. అర్థమవుతుందా అందరికీ? నా భాష చెప్పేది అందరికీ అర్థమవుతుందా? మనం ఏం చదువుతున్నాం ఇక్కడ? మనం ఏం చదువుతున్నాం? మనం చదువుతున్న ఫీటల్ స్కల్. అడిగిన క్వశ్చన్ ఏంటి? क्या क्वेश्चन पूछा जा रहा है यहाँ पर? So the meeting point of sagittal and coronal suture is what? So the answer would be bregma. We know. Good. Sharu C. Sharu bregma. Okay, good. So that is bregma. Okay. Now we will be having a series of questions. Just answer the questions. Okay. So what type of play does a nurse expect when observing a toddler in a playroom with other children? So if you see the types of play in children, there are 4 types. This is parallel, solitary, cooperative, and associative type of play is also there. So solitary play is the child which plays usually alone. So that is called as solitary play. Parallel play is when two children are playing side by side. That is called as parallel play. Cooperative play, associative play, that is playing together. That is called as a cooperative play, associative play. So what type of play does a nurse expect when observing a toddler? So what a toddler will play in a playroom with other children. Toddler is nothing but around 1 to 3 years, as we already told. Toddler is the 1 to 3 years is a toddler. So what kind of play we can expect in a 1 to 3 years child? So the answer is first one, parallel. Correct. Shahrukh, correct answer. So the toddler is still in. So the correct answer is parallel. So parallel is the answer. Okay. Okay. What is the most common nutritional problem associated with Down syndrome? So what is the most common nutritional problem we will find in children with Down syndrome? Whether it is obesity, rickets, anemia, or rumination. What is the common nutrition problem we will find in Down syndrome? So to understand this, we will go through the session of this. We will see about this Down syndrome. So if you look at the Down syndrome, so the Down syndrome is also known as, it is an autosomal disorder, and it is a trisomy 21. So in exam they may ask what is trisomy 21 or what is Mongolism disorder. One second. My laptop charge got over. Laptop charging. Okay, it is also called as autosomal disorder, trisomy 21 or Mongolism, and it is the most commonest chromosomal disorder. And we can find this trisomy 21 or this Down syndrome in the mothers who are giving birth to the children over 34 years of age group. That we will find this Down syndrome. And if you look at the facial features of this Down syndrome baby, their nose, they will have a flat depressed nose. Nasal bridge will be flat and depressed. Here you can see the flat nasal bridge. And if you look at the tongue will be macroglossia. So macroglossia means large tongue, and a protruding tongue we can find. Then if you look at the this chin, the chin will be in small in nature. And if you look at the hands of these babies, they have a single palmar crease on their hand. And if you look at the eyes, the babies will have this. So the babies will have a Mongolian slant. So how usually eyes are there? So this is the eyes will be there. But for in babies with Down syndrome, we have this, the outer canthus of the eyes will be upside. That is called as Mongolian slant. If the canthus of the eye is down in nature, then that is called as, if the outer canthus of this down in nature, that is called as anti-Mongolian. That is called as anti-Mongolian. And one more good feature of this Down syndrome is, that is epicanthal fold. Can you see the epicanthal fold? So this epicanthal fold will be, so when you look at the epicanthal fold, here the upper eyelid fold covers the inner corner of the eye. That is called as the epicanthal fold. So here we can see this upper eyelid will cover the inner corner of the eye. So these are the features. And when you look, and the babies, if you look at the IQs of this baby, their IQ is very low. Compared to a normal child, their IQ is very low. And the facial features just now I have described, that is flat nasal bridge, Mongolian slant of the eyes, the Mongolian slant, and the tongue will be protruded, and their IQ will be very low, and they have a short neck. And when you draw a imaginary line from the outer canthus of the eye to the external pinna, that is ear, they will have a low set of ears. So the ears will be, compared to us, their ears will be they have low set ears. When you draw an imaginary line, from the outer canthus of the eye to the pinna, so their ears will be much low in nature. That is called as low set ears, which we can find in Down syndrome baby. And when you look at the eyes of these babies, they have small typical white spots. White color spots they will have in the iris part of the eyes. So that we can find in this Down syndrome children. And they have a very short neck. IQ is reduced. So understood about this Down syndrome children? Okay. And also they also have this congenital hypothyroidism. And some also have this congenital hypothyroidism. Because of this congenital hypothyroidism, they also suffer with weight gain and obesity. So what will be the answer for our question? So the most common nutritional problem associated with Down syndrome is nothing but obesity. Clear? Okay. The next question. In a newborn with cleft lip, among the following, the most compromised is, so if the baby has this cleft lip or cleft palate, so what is the most compromised thing in them? That is sucking ability, respiratory status, locomotion, that is movement in children, or the gastrointestinal function is reduced. So what will be the most compromised thing in a baby with cleft lip? Those who are online, just answer this question. I'll be waiting for your answers. I'm clear after we will write in all our notes. Thank you, Sharu. Looking at your comments now, I'm blushing. So what is the answer? Yeah, Sharu, correct. Sharu has answered correctly. So that is sucking ability. Krishnaveni, Peddenti, good evening. Okay. So when you look at the cleft lip, so this is how a cleft lip. So this is bilateral cleft lip on the both side. And you look, this is the normal babies how they look. So this is the cleft lip, cleft palate. So this is a bilateral cleft lip. You can see this is the bilateral cleft lip. When the cleft palate, can you see this cleft palate? So here the baby will have problem in sucking and latching problem the baby will get when the baby has this, cleft lip problem, the baby have problem in sucking ability. Next question. Rebecca, okay, Rebecca option D, chara, okay. Okay, nothing wrong in giving wrong answers, ma. Don't feel bad when you're giving wrong answers. This is the time we are going to correct ourselves. There's no mistake. If you want, if we are just in a learning process here, whatever options you feel, just answer. Don't feel that, okay, I'm giving wrong answer, what the madam will feel or what the people online will feel. Don't feel bad like that. You can give whatever answers you like because we are in a learning process. Clear? Okay. The purpose of tetanus toxoid immunization is passive immunity if conferred, long-lasting immunity, or lifelong active natural immunity, or passive natural immunity if conferred. So what will be the answer? What is the purpose of tetanus toxoid immunization in children? So why we have to give this tetanus toxoid injection? It is given for the process of Rebecca Erola. Thank you. Nice teaching, ma'am. Thank you. So the purpose of giving this tetanus toxoid is for the long lasting immunity, and this immunity will last for around 10 years. So toxoids are modified toxins that stimulate the body. So our body will produce toxins, the body will produce antibodies for up to 10 years. So this is for the long lasting immunity the TT vaccine is given. Then next question. Immediate nursing care for a child with meningomyelocele. So for immediate meningomyelocele, what should be the nursing care? Change the diaper immediately if it is wet. Position the infant in prone position with legs abducted. Here. Some spelling mistake here. Okay. Applying sterile, moist, non-adherent dressing to the sac. So if you look at the baby here, so the meningomyelocele we can find at the back. So what we are supposed to do when we immediately see a child with this meningomyelocele on the back, what we are supposed to do? Place the infant in the reverse Trendelenburg. So what is the Trendelenburg position? Usually this is the Trendelenburg position, that is foot will be elevated. Reverse Trendelenburg means head will be elevated. No, this is not the thing we are supposed to do. So we have to apply a sterile, moist, non-adherent dressing, saline dressing we have to put when we feel the meningomyelocele is exposed. Clear? Vinod C, Ramandeep Kaur C, Dhanyavad, Sharu C, good. Okay. What is the purpose of vitamin K injection? So why vitamin K injection is given in a newborn? To maintain intestinal flora, to promote proliferation of intestinal mucosa, to stimulate vitamin K production in the body, to provide protection until the intestinal flora is established. So what will be the answer? So the purpose of vitamin K injection is what? Answer. Kindly like my channel. If they're liking the video, please kindly like my video and kindly share in the nursing groups, whoever they're in the nursing groups, like your juniors, seniors, and whatever staff nurses group or nursing officers group you find. Please kindly share this channel so that the students who don't have this facility of studying with the textbooks, or those who have this lack of this teaching methods, please kindly share this channel or share this video, which will be very useful for them. Okay. So what is the correct answer? The correct answer is to provide protection until the intestinal flora is established. Next question. Okay. 3 days after the birth, newborn appears slightly jaundiced. Nurse needs to understand that is due to. So as soon as after birth, the baby looks jaundiced. So what should the nurse do? Immature. 3 days after the birth, slightly jaundiced. Nurse needs to understand that this is due to immature liver function and inability to synthesize bile, an elevated maternal hemoglobin level, or high hemoglobin with low hematocrit value. So the answer is that is due to immature liver function, the baby appears jaundiced. So there are two types, pathological jaundice and physiological jaundice. So mostly the babies have this physiological jaundice that mainly has due to immature liver function. The next question, we will finish it off. A milk formula that can be used in a child with galactosemia is lofenalac, lactam, nutramigan and sustagen. So the correct answer is nutramigan is suggested as the child for who have this galactosemia. So what is galactosemia? For that babies we are going to give this nutramigan. Next question. So intraosseous drug administration is typically used when a child is under age 3, over age 3, where the critically ill and under age 3, critically ill and over age 3. So the intraosseous drug administration, which is something given at the, if you look at the bone, usually we give at this point we are going to administer this intraosseous drug administration, and usually we give in children who are very critically ill and under age 3. For those people we are going to give drug administration. If you look at the sites of this intraosseous drug administration, it is given at this site, that is the proximal humerus, the distal femur, proximal tibia. These are the sites we are going to administer, that is intraosseous drug administration. That too for in which group? That is who are critically ill and who are under age 3 age group. This particular site is selected. Then, why assessing a newborn, which among the following finding indicate need for follow-up care? So while assessing a newborn, which of the things requires the follow-up care? Babinski reflex positive, or head circumference 33 centimeter, hips are abducted 30 degrees, or umbilical cord has 3 vessels. So Babinski is normal, 33, head circumference is 33 to 35 normal, and umbilical cord has 3 vessels, that's completely normal. So here the answer will be, so the hips are abducted to 30 degrees. The hips are abducted to 30 degrees is the correct answer. Okay. Then, eyes need to be covered during phototherapy session, because why we need to cover the baby during photo session therapy? When just now we we have learnt about this physiological jaundice. Why we need to cover? That is to prevent injury to the conjunctiva and retina. So when the baby is under this phototherapy session, we need to cover the baby eyes to prevent injury to the conjunctiva and retina of the eyes. That's why we cover the eyes of the baby. Next, so cephal hematoma is the swelling. What is the true thing about this cephal hematoma? They may cross suture line, or the soft sock may bulge when infant cries, or this will resolve spontaneously in 3 to 6 weeks, or this condition is unusual when the client has a vaginal birth. So what is this cephal hematoma? Hematoma itself, cephal is head, hematoma is the collection of blood, the scalp. So what we are supposed to do? So this is what is called as cephal hematoma. It mainly occurs due to the traumatic or forceps delivery, we can see, and it is mainly confined to the suture line. So this is mainly confined to the suture line, and it causes jaundice, and it usually resolves in 3 to 6 weeks. And it contains what? It contains the blood here, and the location it is between skull and the periosteum. So it is mainly located near the skull and the periosteum, and it is usually over the parietal bone. We find this near the parietal bone. Clear? Then the last question of the session, test used to confirm meningitis in child: blood culture, lumbar puncture, meningioma myelogram, or peripheral skin smear. So what is the test used to confirm the meningitis in child? So the answer is Lumbar puncture, LP, is the test to confirm the meningitis in the child. Clear? Okay, with this we finish off our session. Thank you being cooperative, and please like my channel, share my channel, subscribe my channel, share in the nursing groups with your juniors, seniors. Don't mind that it is only for the working people. It is also useful for working, non-working, student, period nurses, whoever is there. With everyone, kindly share, please. Thank you. Thank you for being all of you who were there throughout my session. Thank you so much. If any doubts you have, please ask me in the comment section. Thank you, Krishna Veni.